Ladies, have you ever been taking a shower and washing yourself and all of a sudden felt a lump down there that you had never felt before? It was probably extremely disturbing the first time you felt it, and most likely is not going away on its own. If you are wondering what is going on, today we are going to talk about pelvic organ prolapse, which is usually felt for the first time while you're taking a shower or a bath and washing yourself. We're going to be discussing specifically what is causing this problem, as well as what you should do if you notice this lump. But before we even get started, I want to tell you pelvic organ prolapse is way more common than you think. So as you've started to do your research, it probably is very concerning, and I completely understand, but many people's minds go to a very deep, dark place all of a sudden of this could be something way worse than it is. It's often that one of the pelvic organs have simply prolapsed, which I understand that's still not great. We want to get to the root of that, but it most likely is not a deeper, darker issue. So watch this video. We're going to answer your most commonly asked questions and get you started on a journey to figure out what to do about your pelvic organ prolapse. Let's start right at the beginning. What is a pelvic organ prolapse? The simple answer is this. It's when one or more of the pelvic organs have slipped down out of their normal position and are bulging into the vagina, which is putting pressure on the pelvic floor. It could be the uterus, the bowel, the bladder, and honestly, it can even be the vagina that's prolapsing into the pelvic floor. It's not a life-threatening condition, but it is a huge cause of concern, especially when you feel it for the very first time. The next question is pelvic organ prolapse dangerous? Although there are risks associated with pelvic organ prolapse, it is not a life-threatening condition. However, it can significantly impact your quality of life and how comfortable you feel doing higher level activities, including running, jumping, things like that. There is an increased risk for secondary complications. So this would be potential infections or difficulty with intimacy because of the prolapse. And of course, there are definitely psychological effects. As you start to feel like your body's betrayed you, things are not staying where they're supposed to, and you start wondering what is going on inside. It becomes really difficult because although we can feel something on the outside, we don't know what's causing it on the inside. It's for this reason that I definitely recommend you start seeking help as soon as you feel something weird, because we want to figure out exactly what organ is prolapsed and exactly why it happened. There are often different severity levels associated with pelvic organ prolapse. So you may notice just a little bit of a bump initially when you're washing yourself. However, if left untreated, it can progress potentially and become a bigger issue. As with everything in our bodies, when we deal with it, when it's a smaller issue or less of a bump, it's much easier than if it progresses on. For instance, I had a patient who came to me with a pelvic organ prolapse, but by the time she came to me, there were many other issues that were going on. Now, for her, her other issues started first. She had had years of pelvic floor tightness. She had had years of bladder dysfunction. She had had years of constipation, and she had been to see every doctor and every specialist available. Nobody was able to put all the pieces of the puzzle together to figure out what was really going on with her body. Of course, every doctor, the bladder doctor was like, there's nothing wrong with your bladder. And, the GI doctor was like, there's nothing wrong with your gut. And nobody could figure out what was going on with her. So once she had the prolapse, she went and saw her gynecologist that said, oh, this is a pelvic organ prolapse, and you need to go see a pelvic floor specialist. So she came into my office and told me about the pelvic organ prolapse. But when I asked her other questions, like, have you had any issues with urinary incontinency? Have you had any issues with defecation? We opened up this whole Pandora's box of problems that she had been dealing with for years that hadn't found accurate answers because they all started with the pelvic floor. So understanding that you may have more than just a pelvic organ prolapse, you may be hearing this story and be like, yeah, I've been having problems forever too. And I have been to see every specialist and they haven't been able to give me an answer as to how all of these things are related. I will tell you that it takes time when it gets to this point to be able to unravel all the different layers that your body is going through, but it is well worth it. As we peel back each layer for this patient, she's finding greater independence. She doesn't have to be near the bathroom all the time. She's actually pooping regularly, and things are actually moving along so that she doesn't suffer with the pain. She no longer has the prolapse, as well as her organ function is improving. So then the next question I got is, can pelvic organ prolapse be reversed? Yes. As I explained with my previous patient, and I have literally seen hundreds of patients for pelvic organ prolapse, it can be reversed. It is really critically important though to figure out why the problem started in the first place. So your organs don't just slip out of their position willy-nilly, right? There's gotta be a reason. And often it's because there's pressure in the abdominal cavity or things are feeling restricted. They try to find somewhere where they can go, where they can have a little bit more room. And this is complicated because what's going on with the organs? Now, this is not to say that the organs are not working correctly. You may not have a bladder dysfunction. You may not have constipation or diarrhea. You may not notice any abnormal signs. However, it could be that where the organs are sitting in the abdominal cavity, they feel like they don't have enough room. And sometimes they can kind of slip out of position. So, how do you treat pelvic organ prolapse? Once we figure out what the root cause is, of course we address that because we want to help take the pressure off of the pelvic floor. Because when your organs have slipped out, that's a lot of pressure on your pelvic floor. The next thing we want to do is either strengthen or loosen your pelvic floor. And most commonly in my clinic, we do both because it's not necessarily that your pelvic floor is weak. It is more common that your pelvic floor is tight. However, if your pelvic floor is tight in some areas, it might be weak in other areas. So we want to normalize the tone in the pelvic floor. The second step after getting that pelvic floor tone improved and that organ back where it's supposed to be, we want to do any lifestyle modifications that may have led to this problem in the first place. So we're going to talk about weight, we're going to talk about dietary, we're going to talk about lifting habits, we're going to talk about all of these different things to see if we can keep stress off that pelvic floor and keep that organ from prolapsing again. Another option that many women with pelvic organ prolapse feel is helpful is a pessary. And I made a video specifically about pessary and what it does. I'm gonna link that here so you can watch it, but just know that the pessary can be very helpful to support the pelvic floor. It's kind of like wearing a brace on your ankle when you have an ankle sprain. It can be helpful during the recovery process and even to have on hand in the future. Rest assured, there are many non-surgical treatments that you can do to treat your pelvic organ prolapse that provide a holistic approach so you don't have to have those invasive techniques. Now, when is pelvic organ prolapse an emergency situation? I will say that if you have a sudden onset of sharp pain that you have never felt before, you definitely need to seek medical attention as quickly as possible. The other thing is if you are having a significant change in bowel and bladder function. Anytime we see anyone who is simply not able to urinate or having massive diarrhea that's dehydrating them, the really extreme situations. I'm not talking about a little change, I'm talking about extreme. You need to seek medical attention because we want to make sure that there's nothing that's going to cause long-term damage going on. And why does pelvic organ prolapse happen? Well, the most common attribute is childbirth, and not specifically childbirth, but the lack of recovery afterwards. See, in today's culture, we believe that our bodies will heal naturally after childbirth, and for many, many people, it does. However, there are some that don't completely heal. Those people who haven't fully recovered usually have very small symptoms in the beginning. So they're the ones who pee when they laugh, cough, sneeze, things like that. And they're told by their doctor that it's no big deal and it'll be fine and it happens to everyone. However, that situation 20 years later, if left untreated, can lead to a pelvic organ prolapse. This is why we are so passionate about helping women after childbirth who continue to struggle with urinary incontinence, because it doesn't lead to good situations later on. It leads to more difficult situations to deal with, such as pelvic organ prolapse or even the need for a total hip replacement. Another thing that can cause pelvic organ prolapse is hormonal changes as we age, specifically, ladies, as we go through menopause. Now, I will say that the makeup of the pelvic floor does change as we age. However, assuming that a pelvic organ prolapse is normal is not okay. Even though your hormones are changing, many women are able to successfully make it through that transition without a pelvic organ prolapse. So if you are finding yourself going through that transition and having difficulties, I definitely recommend consulting with a specialist to figure out how to keep it from progressing and what support you need to put in place for yourself. And obviously, lifestyle factors can contribute to pelvic organ prolapse. So if you tend to do a lot of heavy lifting, obviously increased weight can put more pressure on the pelvic floor. These things can contribute. So we want to work to relieve those lifestyle factors as much as we can. I'm not saying that that's necessarily what caused it, because there could be other things that contributed to that, but that needs to be part of the answer to keep this situation from getting worse for you. And to be fair, ladies, some people just have a genetic predisposition. You may have heard of people who have ligament disorders, and it shows up earlier in life, usually as hypermobility or increased mobility. Later on in life, it shows up with things like pelvic organ prolapse. As our ligaments just aren't as strong as they need to be, they go through the hormonal changes, and it causes increased stress to an already delicate area. So if you do have a genetic predisposition, this is going to make it a little bit more challenging to deal with. But don't worry, there are still steps that can help you. For someone who has a genetic predisposition, I definitely recommend them talking to their OBGYN to get fitted for a pessary, because if you have a genetic predisposition to a ligament issue, then you are probably going to need that little extra support that the pessary provides. What I want to tell you is that if you are suffering with pelvic organ prolapse, or you just took a shower and noticed a bump and you didn't even know about pelvic organ prolapse before that happened, you are not alone. Many women do not talk about this problem. However, I hear about it every single day in my clinic. So please know you are not alone. The second thing that I really want you to know is that there are non-surgical answers to your problem. You need to find a specialist who will walk with you, who will look at your whole history, who will understand what caused this problem in the first place and help create a path to healing specifically for your body. Now, it can be a little bit difficult, but if you start sooner rather than later, it will heal up quicker. I definitely encourage anybody who has noticed a bump down there when they're washing themselves in the shower or bath to seek help as quickly as possible. It is way easier to treat when it first starts than when it gets years down the line, especially if you have other issues that have been contributing to this problem, such as urinary incontinence or constipation or diarrhea. You may have glute pain or low back pain that you did not even know were associated with this whole problem. It's important to find someone, a specialist, who can look at all of those factors to figure out your specific path to healing.